welcome back to another episode of the 2020 podcast, Canada's #1 optometry podcast. I am your host, Dr. Harbir Sayan. Thank you so much for taking the time, as always, to join me here to learn and to grow, to learn more about our industry and our profession and how we can all be better. Before we get started, I want to say a huge thank you to the BC Doctors of Optometry. We are here at the beautiful JW Marriott Hotel in Vancouver for the BCDO conference, and it's another amazing conference, another amazing weekend, learning lots, meeting new people and seeing old friends, and it's just been an amazing time. So thank you, BCDO, for always doing what you do for optometry in BC. And as always, I'm trying to bring on guests that are going to help us to be better, as I said, to help our profession move forward and for us to be better with our patients. And to help us with that, I have two amazing surgeons here, Dr. Michael Boyd and Dr. Darrell Lewis, to talk to us about some of the innovative new technologies in refractive surgery, in particular, SmartSight technology. So first, if you don't mind, I'd like for each of you to do a little introduction. Dr. Boyd, I'll let you go first.
Yeah, I'm Michael Boyd, the Burnaby cataract surgeon, been in practice for about 30 plus years, and look forward to talking about our new technology.
Dr. Lewis.
I'm Darrell Lewis. I've been in BC now since December of 2023. Moved here from Ottawa, Ontario, and prior to that in Halifax. I'm a cataract, cornea, and refractive surgeon, so have a background in corneal transplantation, did a residency training at Dalhousie University, and then did a corneal transplant fellowship at Royal Victorian Eye and Ear Hospital in Melbourne, Australia. Okay. And then was back in Halifax for a few years, running some of the eye bank services, still running the eye bank to this day, and moved to Ottawa, where I joined Herzig Eye Institute, and really learned a lot of my refractive procedures pertaining particularly to lenticule extraction through Dr. Kashif Bag, who's a prominent corneal surgeon in Canada, as well as Dr. Sheldon Herzig, who's done over 10,000 smile procedures. So worldwide, he's a very strong lenticule extraction proponent, was one of the first adopters, definitely one of the first adopters in Canada. So really a good educational process for me. And prior to that, I had a long experience doing PRK and LASIK, and I was a medical director of a laser facility out in Halifax, Nova Scotia before moving to Ottawa. So really thrilled to be partnering with Boyd Vision, and really thrilled that Dr. Boyd has made the leap to be able to offer people in Western Canada and BC this phenomenal, exciting technology.
Yeah, wonderful, wonderful. So Dr. Boyd, this is exciting technology. This is the first machine of its type, laser of its type in BC, if I'm not mistaken.
Absolutely.
And what made you want to bring this technology to your practice and bring it to BC?
So I got involved in refractive surgery back in the mid-1990s, and then set up my own clinic probably about 20 years ago. And I've been just following along with the latest refractive trends in the interim. I chose not to partner with some of the bigger refractive centers. I just wanted to do my own thing and serve my own patients. I became aware, because I did have a Zeiss laser, I was very tempted to jump into the smile procedure like 5-10 years ago, but I just wanted to wait and see how it panned out. And over the last 3 or 4 years, I was convinced that was the trend line that was happening around the world, especially overseas. And in the last year or two, we were just looking at the technology has evolved, and now lenticle extraction has reached what they call the second generation. More and more companies are getting involved.
Gotcha.
I finally pulled the trigger and decided that Boyd Vision, we couldn't wait any longer here out in the West Coast for the technology. It's available throughout Canada, except in BC. And if I just decided that was the time to jump in.
Excellent. So it seems like that patience and waiting out to see how the technology developed actually worked out well in your favor.
I think so. It's a major investment, and these machines, probably every 8 to 10 years, the next generation comes along and there's better and better features. It's very innovative, but definitely I think now it's reached the stage where it offers definite improvement over other laser procedures.
Gotcha. And we'll want to talk a lot more about that exactly, but Dr. Boyd, you have to head over to get set up, so I want to say thank you for taking some time to join us here. And we'll talk about how optometrists can learn more about this and Boyd Vision specifically a little
Absolutely.
bit later on.
Thank
But
you for having me.
Thank you for joining us for
Pleasure.
this conversation. Thanks, Dr. Boyd.
Pleasure.
Okay, so Dr. Lewis, with Dr. Boyd here, we've already started to mention the term smile. And I think that term's familiar just because that Zeiss laser has been out for a while, so some of us have heard that term before. What is smile, and then how is SmartSight different?
Yeah, so all of these lenticule extraction procedures kind of fall under a nebulous term right now, which we're calling keratorefractive lenticule extraction, or KLEX. So just like PRK or LASIK, KLEX is probably the term that we're going to be using going forward.
Gotcha.
That could change. In the past, we called it RELEX or FLEX, but KLEX is probably where we're going to end up. And SMILE is the original form of KLEX procedures because it was the first to market, made by Zeiss. But the basics of KLEX and why KLEX is different than LASIK or PRK is really the way the procedure is done. So unlike LASIK or PRK, there's no excimer laser that's used, and that's a key difference. It's a single laser platform. It's just a femtosecond laser. So we've been using femtosecond lasers to make LASIK flaps for years and years and years, but the femtosecond laser technology has come forward leaps and bounds. And that has allowed us to actually shape a lenticule, a lens, within the cornea, and then extract that. So the femtosecond laser uses very small energy pulses to create little tiny bubbles within the corneal stroma. We connect these millions of bubbles together to form tissue planes. So it's essentially 3 cuts that the femtosecond laser makes. It makes a deep cut within the stroma, and that is a curvilinear structure that's spherocylindrical and corrects the patient's glasses prescription. So the first cut is the deepest cut, and it's a little smaller. And then we make a cut overlying that called the cap cut, which is just a linear lamellite cut. And then we make a cut to the surface. So there's 3 cuts, a refractive cut, a cap cut, and an incision. We then dissect out through a 2 millimeter tiny little incision on the surface. Use a little spatula to go below and connect all those little bubbles together, go above to connect all the little bubbles together. We now have a free-floating stromal lens inside the cornea, and we prolapse that out, and the procedure's done.
Interesting.
So it's a very fast, maybe 3 or 4 minute procedure. Patients don't lose vision during the procedure in the same way that they lose vision when we make a femtosecond laser flap. So it's a much more reassuring procedure for the patient. Cooperation is a little easier, suction is a little more stable. So there's numerous benefits here, not mentioning the fact that we only have 1 laser platform being used. There's no loud noises like there is with an excimer laser. There's no funky smells like there is with an excimer laser. And these are subtle differences, but they do make a difference to the patient's experiance in the end. And so
the smell is something a lot of people report.
yeah, they do complain, you know, and I smell it all the time, and it's not a pleasant smell. So, there are advancements, but it's really these 3 cuts done with a femtosecond laser. And so KLEX really falls under now 4 different names. And so SMILE is the brand name for the Zeiss platform machine, which was the original and it's now in its 2nd generation. Schwind is a company that produces a femtosecond laser called the ATOS, and the KLEX procedure done on that femtosecond laser is called SmartSight, which is the technology that Dr. Boyd and Boyd Vision is invested in. And we really, really like it, and I'll talk about some nuances and specifics about that afterwards. Just to mention that there are other laser platforms available. Ziemer is another company from Germany that makes a laser platform called the Z8, and they've called their KLEX procedure Clear. And then Johnson & Johnson Vision has produced a femtosecond laser called the Alita, and their KLEX procedure is called Silk. So as a community, we need to get used to hearing all these different names. We're not just going to hear LASIK, PRK, KLEX. We're going to hear LASIK, PRK, SMILE, SmartSight, Clear, Silk. And we have to get used to these names because patients are going to use those names when they come into your office saying, hey, I want to have SMILE. You need to say, well, SMILE is the same thing as SmartSight, is the same thing as Clear, is the same thing as Silk. And of course, there's differences, just the same way an Alcon excimer laser is not the same as a Zeiss excimer laser.
Yeah, so because Zeiss was first to market, they've kind of become the Xerox of this particular segment. But that's really important for us to know as optometrists, because I imagine each company and each surgical center who has these machines is going to market their specific laser, right? And so we'll have a patient come in and say SmartSight versus SMILE or something. We need to know. We need to be, as optometrists, on top of that, understand what they're asking for and that specific procedure and what it is. So thank you for that. So how does, and you've gone into quite a bit of detail already as far as the different, the cuts and the lenticle extraction. Where does this fit as far as compared to LASIK and PRK, and why would a patient consider this versus those? I know you've touched on some of them already, using the one laser platform and such, but other benefits?
I think from a patient perspective, there's a much faster visual recovery than there is from PRK.
Oh, okay. All right.
The procedure is painless, so you should expect visual recovery speeds and ease of visual recovery similar to a LASIK procedure, but with less risks. And anytime I'm doing a refractive procedure, I always want to know what's going to give the best quality of vision with the lowest risk. That's kind of my mantra always. Makes sense. Best quality, least risk. And so, lenticule extraction really hits that very nicely. With LASIK surgery, we're cutting a lot of corneal nerves, okay? The subbasal nerve plexus, those nerves are reduced by 90% because of the very large cut that is being made to make the LASIK flap.
Right.
With lenticule extraction, we're only using a 2mm incision. And so that's only 2mm of disruption versus 270 plus degrees of disruption.
Right.
And so there's a much stronger preservation of the subbasal nerve plexus, maybe knocking out somewhere between 50, maybe 70%, but certainly not up at 90% like LASIK surgery. And this translates to a much faster visual recovery from a much more stable tear film, a much lower risk of dryness of the eyes following the procedure, because the cornea is less neurotrophic afterwards.
Gotcha.
So dry eye hits less frequently and it hits less hard. By about 6 months, the LASIK patients are starting to catch up in the regeneration of their nerves. There's still a trend towards a better outcomes as far as dry eye and corneal sensitivity is concerned from a lenticule extraction procedure.
Gotcha.
So SmartSight, Smile, Clear, Silk are all going to produce less dry eye and have a faster overall visual recovery than a LASIK procedure is and a PRK procedure is.
Gotcha. That's all really good stuff. As far as long-term stability of the cornea, is there even if you go back to PRK versus LASIK, if you don't mind touching on that, is one of these procedures going to give us better stability in the long term and safety profile maybe?
There's no question that we're seeing lower regression rates out of a lenticule extraction procedure.
Okay.
We're seeing lower ectasia rates out of lenticule extraction procedures, and I need to tease those two apart. So when we do LASIK surgery, that large cut is in the anterior 1/3 of the cornea. Well, that's the most compact collagen. That's the most biomechanically rigid, strong part of the cornea. And you've severed Bowman's membrane, okay? And so what happens is you get posterior bowing of the cornea, and you get peripheral collagen lamellae bunching up, which creates a lot of spherical aberration. And the posterior bowing causes regression. You also get significant epithelial hyperplasia. So when we're talking about myopic treatments, you flatten the central cornea and the epithelium will actually thicken afterwards. So a normal epithelium is about 50 microns. Post myopic laser refractive surgery, be it PRK or LASIK, we see maybe it's 65, 70, I've even seen 80 and 85.
Wow.
Okay, so the central epithelium thickens up and that causes regression over time. We see less bowing with a lenticule extraction because we have greater biomechanical integrity that's been saved as a result of the procedure and less epithelial hyperplasia over time. Something about the excimer laser pulses tells keratocytes to signal the epithelial cells to thicken more. And so we're seeing a little less epithelial hyperplasia. It still happens, but a little less epithelial hyperplasia with lenticule extraction procedures.
Okay, that's good to know.
I'll just touch on safety from ectasia really quickly.
Yes.
So we think about PRK being the safest from an ectasia perspective. But if you look at the data, there's been about 7 million lenticule extraction procedures done worldwide. And you look at meta-analyses, lenticule extraction is actually a lower incidence of ectasia than PRK and LASIK at this point in time. Now there's selection bias in this, but we need to think about LASIK probably being the highest risk of ectasia, PRK and lenticule extraction being very similar in the risk of ectasia. And there's a lot of different biomechanical studies going on right now trying to tease out the differences between these things, but there's no question that lenticule extraction is preserving biomechanical integrity better than a LASIK procedure is.
Yeah, absolutely. Absolutely sounds that. So that's really good information for us to know from the optometry side of things if we're trying to look at what's the best procedure for our patient or most safe and going to give them most, stability long term. So in that vein, how would an optometrist decide which patient is the right candidate for this?
Well, right now, lenticule extraction is only for myopic patients.
Okay.
So the SmartSight, the Schwind ATO SmartSight that's available in BC now through Boyd Vision and Langley Eye Surgeons, that is only available from a spherical equivalent of -1.5 up to -12.
Okay.
Okay. And then astigmatism-wise, we're currently Health Canada approved to do 2.5 diopters of astigmatism.
Okay.
Which will be expanded to 6 diopters of astigmatism,
Oh,
which
wow.
is
And we should talk a little bit about why that is,
Yeah.
but that's sort of the range right now. So if you're mixed cylinder, you're hyperopic, you really are looking at a LASIK or PRK procedure still.
Gotcha.
I don't treat hyperopia greater than around 3 diopters. And I really don't like doing a corneal refractive procedure sort of over 9, -9, because the changes that you're altering in the cornea, the weakening that you're altering in the cornea is starting to really get up there. I mean, if somebody's a very thick cornea, maybe it's okay. But for most people, once we hit that range, we're starting to look at alternative procedures. And the most common alternative procedure is really the implantable Collamer lens, the ICL, which has been redesigned for myopic patients. There's a central hole in it now. It's a phenomenal, easy, straightforward, reversible procedure. So there's really good alternatives. And when I see laser centers that are treating very high prescriptions still, I really get a little bit nervous. Just a couple days ago, I was in the minor procedure room and I had a patient that had PRK 6-7 years ago, and he has horrible anterior stromal haze. I take his epithelium off, and the surface of the stroma just looks like hills and valleys. And so now I got to try and remove all this scar tissue that's there from the PRK that they had 7 years ago, and the vision will just never be the same again. So treating really high prescriptions, we have alternative options now that I think are safer, and that's coming from a cornea person.
Right. Well, I appreciate you actually mentioning that, because that's something I wanted to ask you about, is when you get to those higher prescriptions or somebody who may be not a candidate for this, what are the alternatives? So ICL is a good option and something that higher prescription patients could look at.
Yeah, and in suspicious corneas, right? So lots of laser centers turn people away. The highly motivated patient that really, wants to be able to do things in their life without wearing glasses. Maybe their fitness is at risk if they're not able to do things without glasses, and they can't wear contact lenses. So you need to find ways to help people. And so ICL is available. Let's say somebody has form fruus keratoconus or subclinical keratoconus. Well, I'm not going to do a laser procedure on them, but maybe I do an ICL for them.
Taking a bit of a tangent here, and if you can, to the best of your ability, I know there's a fair bit of fear around laser procedures, and there's communities out there, there's online forums and things like that where people are speaking negatively about laser surgery, if they've had negative experiences, or they're cautioning people about the downsides of laser surgery. Do you have any insight into what type of experience those people have had, perhaps, that didn't led to negative outcomes? Was it poor selection, patient selection? Was it the wrong type of laser surgery, or something else that might have gone wrong there?
Well, I mean, that's obviously a very multifactorial question, right? I mean, I always start by telling people that this is an elective procedure. It's a lifestyle choice. It's a personal choice. There are risks and pros and cons to everything in life. So, there's very few risks to wearing a pair of glasses. Some people really struggle with it, especially if they have high prescriptions. There are significant risks to wearing contact lenses. And I think, it's always on us as eye care professionals to really be counseling patients on how to use contact lenses properly. But there was a large meta-analysis that was done looking at the cumulative lifetime risk of wearing soft contact lenses versus having a laser refractive surgery. And it absolutely favors refractive surgery over long-term contact lens wear. And we really need to get a little bit more granular about it. If someone is a daily disposable contact lens wearer who's diligent to not overwear, that never sleeps in their contact lenses, that person's safe. They're going to do well with soft contact lenses.
Right.
But I think it's our job to tease out those patients that are wearing monthlies and sleeping in them, not changing them, not cleaning them, swimming in them, showering in them. Those people are very high risk for cumulative lifetime risk for infectious keratitis.
Right.
And those people really should be thinking about a refractive surgery. So it's a very personalized decision. Refractive surgery is not perfect. It's not a panacea. We can still get dry eye. Even with this lenticule extraction procedure, we can still get dry eye. If you get decentration of the treatment, or you get too small of an optic zone size, that can lead to halos and glare at night.
Okay.
It induces coma by having decentration if we're not treating directly on the visual axis. And it induces spherical aberration if we're using too small of an optic zone size, or the patient's pupil gets very, very large at nighttime. So patient selection is very important, and matching the best procedure for that patient's individual eye is really important.
And these are all, I imagine, factors that you're assessing beforehand
Absolutely.
to determine which is the right option for them, or if it's the right candidate for any of this, any of the laser options. Excellent. Let's say we've decided this patient is a good candidate for SmartSight. What can optometrists do to help improve their outcomes, such as treating dry eye ahead of time? How important is that? And then post-surgery, what are things that optometrists should be looking out for?
Yeah, absolutely. I think the most effective laser refractive surgery is the surgery that has the best preoperative refraction. And so, like, you can have the fanciest technology, which absolutely, the Schwinn ATOS Smart Sight is the pinnacle that you can get right now. It's in my opinion, the best worldwide. If I'm off by a quarter diopter, half diopter, 0.75 diopters, patient's still not going to see well afterwards. So, someone coming into our office who's been wearing their contact lenses that morning, there's going to be epithelial remodeling from that. I'm not going to know, is that what the final prescription I should be treating is?
Right.
So it's really on us working together to make sure that the dry eye is well treated, that the contact lens wear has been pared down, that they've been wearing their glasses a lot more frequently, and that I've got a good history of your refraction coming in, and that my refraction matches your refraction.
Right.
Now all the stars align, I feel I can really give a good treatment to the patient.
Yeah.
Where we introduce a lot of negative experience is when someone comes into the office and I say, well, my refraction today is a little different than what your historical refraction is. Is that something that's changing? Is it not changing? All of a sudden I've introduced uncertainty. The person's already fearful of this procedure.
Yeah.
Nobody likes somebody operating on their eyes. So you introduced it on uncertainty, and that really ramps up the anxiety surrounding the procedure. So we want things to be a smooth process, and we want consistency. And that really, really starts prior to the referral ever being made.
Yeah.
So if somebody likes to treat dry eye, you notice a little dry eye, and you've got RF or IPL, or you've got your favorite anti-inflammatory, like, please start all of those things in advance of the person ever coming to us.
Gotcha. So having that ocular surface optimized, I assume, is a benefit to the patient ultimately.
Absolutely.
Yeah. And is that something that, I know you just mentioned it, but you'd encourage optometrists to speak with patients ahead of time. If you're considering laser surgery, let's make sure we optimize that ocular surface.
Yeah. And I mean, doing all of that in advance makes a big, big difference, because it means that the risk of needing an enhancement is a little lower.
Yeah.
This ATOS system is phenomenal. When I program a -6, I get a -6 98.8% of the time.
Wow, okay.
So it's an extremely accurate device. But again, if my refraction is off by a quarter half diopter, if my axis is out by 6 degrees, these things really make a big difference.
Sure. Yeah, absolutely.
Yeah.
And anything else on the Schwinn in particular, as far as what sets it apart, that we haven't touched on yet?
Well, we talked about decentration, and we talked about optic zone sizes. So if you compare the optic zone size that a lenticule extraction procedure on the Smart Sight will produce, it's always larger than the same optic zone size produced by an excimer laser, LASIK or PRK. And so that means that there's less higher order aberrations, less spherical aberration, and better nighttime vision. Decentration was one of the original sort of drawbacks to the SMILE system, because we weren't able to take visual axis information from a diagnostic device and program it into the laser. Well, that's been solved with the ATOS. We have this extremely sophisticated device called the MS39. It marks the visual axis, it digitally transfers that information to the laser, and as we dock the laser, it moves the treatment over top of the visual axis. So the centration piece has been really improved, the cyclorotational piece has been significantly improved, and the postoperative tomographies are just the best I've ever seen out of any refractive procedure.
Wow, it's all very, very positive, exciting. So we've talked about, we touched on sort of the history of a little bit on refractive surgery, PRK, LASIK, and we've talked about what these KLX procedures are and the various. What are we looking at? What are you excited about in the future, and where's refractive surgery heading, do you think?
Yeah, I mean, if you look at large open markets, myopic treatments have all shifted towards lenticule extraction procedures.
Okay.
In Asia and other parts of the world, they're doing a SMILE procedure or a lenticule extraction Smart Sight or a clear or a silk, and in some places they're banking that lenticule. So they actually take that as donor corneal tissue now, reimburse the patient for, give them a rebate for the fact that they donated their tissue. And now they know I've got a +6 cylinder. I've removed a -6 for the patient's treatment. That's a plus cylinder. You've removed +6 from the cornea. I now bank that. Somebody comes in and they're +6 hyperope. I can now insert that lenticule into the same pocket.
No way.
So that was something that was not really available before, but we're starting to see creeping in inlays, allogenic inlays, which is really, really cool. There's a new technology called the transform inlay. That's an allogenic, small little disc that we're going to be placing on the visual axis as a presbyopia treatment. Where I see this going is in the future, we're going to have hyperopic and mixed-cell lenticule extraction profiles.
Yeah.
Those don't really exist in North America right now, but they're available in Asia and in Europe. So we will get those eventually. So it won't just be myopes, it'll be hyperopes, it'll be mixed cell patients that can be treated on this platform. And we'll start to do really, really cool things like customize the shape of a donor lenticule for keratoconus and now insert it. So instead of removing tissue from a keratoconic eye to do a topography-guided PRK and a cross-linking, we're going to slide in donor corneal tissue, make the cornea more robust, and then cross-link this new and improved shape.
Wow, okay.
So lenticule extraction, lenticule procedures are really a translation of a guy named Jose Barraquer, who was a phenomenal Colombian ophthalmologist who was freezing donor corneal tissue, cryo-lathing it into different prescriptions, and then setting those lenticules on top of the Bowman's membrane and letting epithelium grow over top. He was doing this back in the 50s. And so we now have femtosecond lasers. We don't need a cryo-lathe. We can be much more precise about it, and we can create very precise pockets to inlay these things rather than onlay them. And I think definitely this is the future of refractive surgery.
That's incredible stuff. Wow, that's definitely things I've never heard of before, and seems like it's going to open up a lot of opportunities for patients who have not been able to, have access to.
I mean, everything has drawbacks. Okay, lenticule extraction is not a perfect panacea. We can still get epithelial ingrowth. We can still get some microstriae. Those sorts of problems can still exist. But I'm not going to have somebody that was in a car accident with a displaced flap. I'm not going to have 7 years later down the line horrible haze where I can't really correct the vision in any way now. And so I think we really opened up a new window, and a lot of people are jumping through that. So
it's excellent.
I'm happy that BC is now there too.
BC's here, and I'm really excited that we will be able to, from our own office, be sending patients over to Dr. Boyd or to Boyd Vision to have the opportunity to have this procedure. It's amazing.
Yeah, so as far as referrals are concerned, I mean, Boyd Vision is the only place in BC where someone can have a lenticule extraction procedure performed. We're kind of doing pre-ops at both Boyd Vision and Langley Eye Surgeons. Okay. So Langley Eye Surgeons is obviously based in Langley, and Boyd Vision is in Burnaby. So if you're in any of those geographic areas and you want to send some patients in, we've got a referral guide set up where we're happy to see the patients. Yeah,
and I think even to be able to access the most advanced technology in refractive surgery, I think a lot of people would be willing to travel. So, we have an office in Abbotsford and in Surrey, but I'm sure there's people out in the Okanagan or wherever that would drive a few hours, to have this procedure.
Well, to your point, it's a disservice to patients to not have procedures that patients want available. Because what happens is people will travel, and sometimes they travel to dubious places. So a lot of people in the Vancouver area have connections to Asia and have been traveling for years to Asia, where SMILE is probably 80% of the myopic treatments that are done are done via lenticule extraction. And they'll fly to Asia and have the procedure done, which is fine. They're great surgeons in Asia, great surgeons all over the world. But for instance, I had a guy who had keratoconus, and he went down to Peru to have his intact segment placed to correct the shape of his keratoconus and cross-linking performed. And I said, well, why did you go to Peru? And he said, I assumed he was going to say, well, it's a lot cheaper. I didn't say that. He said, because you guys are way behind. And that really struck with me. And it's a story I tell a lot of people, because that made me realize, hey, I'm doing a disservice to people by forcing them to travel and putting themselves at risk, because what if there's a complication and they're in a foreign place, by not offering things. So by not making things accessible, you really can do harm.
Absolutely.
And we need to not harm people. Right. And I'm really happy that people now have the option to do this kind of procedure.
Yeah, that's wonderful.
The roadblocks have been removed.
Yeah, that's excellent. So we will make sure in the notes we put links and contact information and everything like that. So wherever you are, if your patient's interested or you're interested in having your patients look into this procedure, you can get in touch. Any other final words of wisdom or topics we haven't covered that you'd like to discuss?
No, just thank you so much for having us on and for talking about this exciting technology and moving forward with things. I'm enjoying meeting a lot of the optometric community here in BC, because I've only been here for about a year. And there's a huge thanks that goes out to Boyd Vision and Dr. Boyd for being the one that made the investment to make all of this possible.
Absolutely, absolutely. Thank you, Dr. Lewis, for taking the time to discuss this. I really appreciate that you are making the effort to connect with the optometric community as well. And often there's a bit of a space there, and sometimes either side is a little hesitant to reach out and make that connection. But you've been doing a great job.
I mean, especially in the refractive space, I think all those barriers need to disappear, because this is somewhere where we absolutely are co-managing people.
Yeah.
We don't have the patients long enough in our center to know their history. And the history is so vitally important to getting a good refractive outcome. So we really need good communication and good relationships between the optometric and and surgeon community.
Absolutely, absolutely, and all the credit to Dr. Boyd and Bonnie for years for making those the effort to make those connections. So it seems natural that you're working with them and you're making the same amount of effort. So thanks again for taking the time, and once again thanks to Dr. Boyd and Boyd Vision for bringing this technology to BC so we can serve our patients better, and for partnering with the podcast. And of course, thanks to BCDO for once again hosting an incredible conference. Thanks again for listening and watching to the 2020 podcast, Canada's #1 optometry podcast. We'll see you guys in the next episode.